Welcome to Logicon Carries Detector software. During today's session, we will define Logicon Carries Detector software, navigate the software tools, explore help options, show warnings and cautions, and demonstrate the software. What is Logicon Carries Detector software? It is a software device that is meant to aid in the diagnosis of caries. Some criteria is necessary when utilizing the tool, and that is based on the statistical information that's available. So unrestored proximal surface of secondary dentition is what's called for. This is just meant as an additional information for the clinician, and he or she should use their own diagnosis of the tooth surface on those that are suspected of being carious. It's designed to work with the Carestream Dental RVG digital sensor as well as the Carestream dental imaging software. Once the software is installed, it can be accessed through the dental imaging toolbar, which in version 8 of Carestream Imaging is located under the Starburst tools. Once an image is available, you can click the icon and it takes that particular image that is selected into the software. The Logicon Carries Detector software tools are along the top, and there are some do's and don'ts that are available for utilizing the software. So we're going to review those in just a second. What we're demonstrating on this particular slide is we ran the V tool, a manual tool, to run an analysis on a specific site. So on the image itself, we cannot identify 10 layers of enamel or 5 layers of dentin. We just show it here, 3 lines of each. But it's up to the clinician to determine, did the software find those layers accurately? And we have some tools that'll help you identify that in a moment. Also on the upper right, the density plot shows where there were dips in the enamel, usually a carious lesion. It could be decalcification, it could be some other demineralization that has occurred, but these are typical of the path for caries. So they're just showing you they did find 10 layers in the enamel, 5 layers in the dentin, and based on that data, the statistical data of images of teeth that were showing caries, they have a gold standard, a probability, and when that has exceeded that threshold, the recommendation is to restore the tooth. So we'll get into that information in just a minute. This was a quick little overview. And notice how the image is its normal size as if you had taken it, but if you double click the image, it actually enlarges in the software, and then you're allowed to pan around in the software. So I would say if it's early on with you utilizing this tool, understanding the do's and don'ts is imperative, and that's available for you through this help icon. So if you click the help icon, you can see the first of the help tools is do's and don'ts for V-tool. So here we have the V-tool starting in the center of the tooth, working its way towards the CEJ and at the marginal ridge, basically highlighting the dentin to enamel junction. That's the acceptable way to utilize the V-tool, not on the occlusal, because the clinician can check that surface for themselves. Here the V-tool was too small, too far away, too large, and here it was on a restored tooth, a tooth that already had a restoration. So it's not meant for use on that. So the easy steps for V-tool would indicate that you have to select the type of tooth. So I'll take you into the software now and demonstrate the V-tool use for you. So we're saying that you select the type of tooth that's needed, work from the middle of the tooth towards the dentin to enamel junction, and then let go, and the results will be shown. So we'll come back and look at some more of these help files in just a moment. At the top is where I can select, do I want to use the pencil, and you'll see why in a moment, versus the V tool for the manual analysis. And then what type of tooth do I want to run the analysis on? Get rid of that analysis. I'm going to run it on a premolar, and this is the site I'm going to work on. So in the middle of this tooth, my starburst indicates that I'm using the V tool. So I left-click hold, and I work towards the suspicious lesion. Notice if I drag my mouse up, the whole V tool is moving with me. Basically, when I move it left and right, this is opening it wider and making it smaller. So that's how you can control what's happening with the V tool. But when it's placed as described, CEJ, marginal ridge, let go, the analysis begins to form, and we have a pretty solid conclusion, a high probability that there is caries on this image. And maybe you saw it yourself because you have a trained eye. The software is looking at more gray shades than the human eye can see. Your CareStream sensor captures 4,096 gray shades, and the untrained eye sees maybe 33 gray shades. A trained eye might see somewhere around 40 gray shades. So that's what this analysis is looking at. In the help tools, we're going to talk a little bit about the region of interest tool and what's happening. Because right now, if you're not clear what's happening and you say, yes, I want to adjust it, you're just randomly dragging this box around trying to find a pretty clear plot, which I thought it found it pretty clear by itself, and now I'm being made to try to replicate that. So let's see if I can replicate that. Still not as good as it was when the tool ran by itself. My human hand doesn't have the precise action that the software did. I see it and then I don't see it. So let me show you what the region of interest tool is doing for us. In the help files, basically 9 calculations were run for us, and by moving it around, you're looking for what's called the best answer. So there are many different dips, but decay doesn't penetrate the enamel surface and then jump all over the place. It's usually a straight line once it penetrates the enamel and works its way into the dentin surface. So these 9 calculations are not random. They're in this particular orientation. So if you start here by holding on to the region of interest tool, you can move it to the 4 corners or you can move it up and down. I kind of was circling it, just looking for the density and dots that were clear. So it's saying that you have that option, and if it's scattered all over the place and it's not a conclusive decision, then you can always discard it and run the analysis a different way. So for instance, maybe there was an overlap that was causing it to be not consistent. So yeah, it's telling you to look for the deepest pattern to know you have the most conclusive service, but if most conclusive answer, but if it's not, you can go ahead and delete it and start it again. So speaking of starting it again, let me show you about the pencil tool, because it's another one of the manual tools, just like V-tool. On the pencil tool, you're still selecting the kind of tooth that you're running the analysis on. You're still starting in the middle, but instead of holding that click, you're going to release it. You're going to trace this outside edge, cemento enamel junction, excluding the overlap. So don't let that be into your scan. And then the dentin to enamel junction, trace it straight up here. So we'll give that a try. Although I don't see any overlap that was on that particular image, I do have some overlap here. Maybe a little bit here. I'll try this distal surface of this premolar. So I'm going to tell the software that I want the pencil tool, I'm going to still tell it that I want the premolar. Now instead of a starburst, I have a pencil. I'm going to left click hold. Sorry, I'm going to not left click hold. I'm going to left click and release. I'm going to trace from CEJ on this outer edge of the enamel, stopping right here on the occlusal, and then trace this inside dented to enamel junction and let go. And it does say that it sees some suspicious densities, and it would recommend using the region of interest tool, which is available for V-tool, not so much for pencil tool. This is just a help tip that pops up. And you want to look for complete dips in the density. So not only is it squirrely, somehow miraculously it skipped all the layers of enamel and just jumped right into the dentin. So we know this is not a valid description. So it's asking, do I want to save my results? And I can say no and do it again. And since I don't see a high level of overlap there, I'll just let the V-tool do the action for me. So the V-tool did a better job, and I can use the region of interest tool to move this around and make sure I'm getting the best answer, the smoothest track of dips, if you will, and not squirrely all over the place. You can see the lesion probability is also scattered. That one's pretty smooth, still into the dentin, and I'll say yes, that I'll save it. So these are all manual calculations, and some people just want the software to do everything for them, and they can just run a look at it. So that's what this icon is for. And when you first open the software, it can run an auto scan on all surfaces that are candidates for the software to be run. So if it's not a candidate because it has an existing restoration, it will have a blue X on it, which just indicates the analysis could not be run. If you notice in the results index window, these were my doctor analysis done manually. And then when I do the lightning bolt over this little bite wing look, then you're going to see that was the automatic tool, basically. So it's pre-scanning all available surfaces. And then if it has an X, that scan was not performed. If it has red pathways, they're suggesting those are candidates for restorations, and the yellow is just sort of a watch. Now, how do I know which is which? In the result index window, I have arrows, so I can click the arrows, and it'll indicate to me that number 3 was the pre-scan that I was looking at previously. So here I am in the lightning bolt. Let me find number 3. I can turn the arrows off now that I know that's number 3, and double click to let me, the clinician, adjust the region of interest tool and decide, do I want to accept this path? If I say yes, that particular scan is now pre-scanned under the doctor section because the clinician actually looked at it and approved it to bring it on over. So you can just let the software do it all, and you one by one confirm the findings, if you will. So speaking of confirming the findings, let me bring this particular analysis back. How do you confirm the findings? Well, number one, you want to make sure the green did identify enamel, the blue did identify a dentin. So I can't see it, it's tiny. Double click, it enlarges, and I'm able to scroll up and down or pan this into my view. And I can toggle on and off this finding. So I'm saying, can I really see that dentin to enamel junction? Maybe not so well. And there's some tools up here at the top because this radiograph defines it very well for me, but sometimes depending on angulation, the image may not show it so well, or if it's over-radiated. Is that a word? If it's overexposed. So if I click this icon, Enhance DEJ, and now toggle on and off, it just really helps illuminate for me that that green line is at the edge of the enamel and the blue line is the first line of the dentin. And if you don't agree with that finding, you don't feel like the software really identified these parts, you could run the analysis yourself. But those are some tools that might be helpful for you. And they have other tools. You can apply filters, you can apply brightness contrast to the image, just anything you need to do to identify these landmarks or these points. Sometimes just giving your eyes a relief and reverting the image to black and white, negative, just doing the reverse for you. We're not saying run Logicon that way. We're just saying sometimes it's helpful on an image to keep applying various filters to identify the various landmarks. So toggling these on and off is important, and this is how you exit the software. So we'll continue through so you can know what tools are available to you and you can know what warnings and cautions to be aware of. When the software is installed, you'll have an icon similar to this for Logicon support, basically. And for that, you can select from various languages, English if you choose, and what will present to you are some folders. One of these folders has PowerPoints which are narrated training from the developer himself, Dr. David Geckenheimer, so that you might find that information helpful to you, and some quick start guides. But things to be aware of in terms of warnings and precautions is that based on the data that's available, Logicon is meant to be run on unrestored proximal surface of adult teeth and not on baby teeth, not on occlusal surfaces, not on existing restorations. Therefore, those results could be misleading. That's the warning. And the precautions are also things that you may have heard during this presentation or before, is if it's improperly exposed, underexposed, overexposed, the software can't detect it. If you can't see it, it can't see the dentin to enamel junction. And avoid overlaps. We showed you how to use the pencil tool to work around it, but it's a precaution. Also, it's designated for proximal surfaces as the interest, so just be careful for extraneous information. If you have cervical burnout, for instance, or if you have some kind of wear on the tooth that caused it to be concaved, it may appear as a dip in the density and may skew the findings, so be aware of that. Also, the devices you use to hold your sensors, sometimes those will cast shadows on the image and also cause readings to be false, and poor angulation, of course, will make it be false. So you always want to utilize those tools, making sure that the DEJ had been found correctly, and I showed you some of the tools that were available for that. You can always rerun it, trace the boundaries manual using the pencil option to get around that particular thing. So highlights for potential lesions on an x-ray. This particular one shows if the lesion penetrates into the dentin. So that's the path you see in red, and we already discussed the green and the blue. Also, we discussed the fact that the software can analyze more shades of gray than the human eye. So the tooth densities and the different variations is that it's a very important plot because we want to make sure that it's showing the density changes across the actual carious lesion or area of interest. If the pattern or the dips don't meet the criteria for penetrating for the decay penetrating into the enamel or going into the dentin, the software will highlight this path for you in red. So those are dips that typically correspond with a structure of the tooth that was different or demineralized is the common reason for that dip. And if they're not scattered about, if they're close in alignment, then you can trust that is the true path. Otherwise, you can move the region of interest tool to make sure you don't have scattered dots. That's just not how decay works, right? And we keep referring to this historical data. Basically, when the developer was developing the software, he gathered teeth and then x-rayed those teeth and then actually dissected or cross-sected these teeth to come up with the baseline. And that's the statistical data that we're referring to, is how the lesion probability comes to play. So basically, they call that the gold standard, and it's shown to you in a graph known as the lesion probability with a decision threshold. When the correlation of the new image is close with the cases that are in the database that did have caries that were known, that's when you see that high red bar in the lesion probability. So probability is based on that correlation, and you want to consider treating it when it exceeds that decision threshold. So speaking of decision threshold, the criteria for the decision threshold is based on a 15% a false positive, basically a false alarm. But I'm going to show you a graph that tells you why you really shouldn't modify that, although there is a preference setting to do that. So they're calling that the gold standard. They're calling it the optimal point for caries detection as found during this study. And yes, it can be adjusted in the preferences. So here's what we're talking about. The sweet spot, the 15%, is represented with this dotted line of the false positives. If you modify that, if you maybe make that percentage less, you're going to see that you treat less cases with true positives, but less cases can be found. And then if you increase it, saying, wow, I'm just going to cast my threshold really wide and just be aggressive about the whole thing, you don't get a better rate of cases. So the optimal setting, 15% false positive, based on this particular study and this particular curve, indicates that that's the optimal point for the decision threshold, if you will. So during today's class, we defined the Logicon Carries detecting software. We navigated the software tools. We explored the help options. We looked at warnings and cautions and demonstrated the use of the software. Thank you.